Hi, this is Dr. Spencer Zimmerman. Can a concussion cause depression? So I just want you to imagine that you're driving in your car and you're just, you're going to the stoplight and someone comes and hits you from behind. This has happened to many of you. You start with some neck pain and some headaches. You may have been diagnosed with a concussion. Now, either immediately, which is not necessarily as common, but a week or 2 weeks, and then it goes on for months, you may have noticed your mood starts changing. You're maybe a little less patient. You're more irritable. You could be anxious, but also depression. And depending on who you're seeing for care, you would then be sent to a counselor or a psychiatrist, or your primary care physician gave you an antidepressant. It is actually very common to get depression following a concussion and occurs in about 50% of individuals. Even if their concussion occurred years ago, it increases your risk of depression in the future. So it does not have to be immediately with the injury. Why do you get depression, you may be wondering? Well, one of the areas most susceptible to a concussion is the front of your head, because the whipping motion of going forward and back, and so the front of your brain hits that inner part of your skull in the front, causes damage to it. The other thing is direct impact, hitting your head on a steering wheel, football players colliding as well. Now, the frontal part of our brain is what makes us humans. It's where our executive and our higher functioning lives. And when that area is damaged, we are much more prone to depression. It's caused by impaired firing within those parts of the brain. One of the newest treatments out there that's FDA approved for depression is transcranial magnetic stimulation. And what that means is there's a magnet placed over a part of the skull, and it delivers pulses to either increase the firing within parts of the brain or reduce it. Now, for what is FDA approved, it actually increases firing on the left frontal lobe. And in a subset of people, 50 to 60% of people, depending on the research, it then helps their depression because it gets the brain to reconnect. Now, that's not the only way to help depression following a concussion. The best way to help depression following a concussion is not medications, but to find the parts of the brain that have been damaged. And as you do that, you reconnect the brain, whether it's through transcranial magnetic stimulation, vestibular therapy, vision therapy, or neurofeedback. Depression tends to improve with it.